This is NDTV, and you're watching NDTV Prime.
Filthy puddles and pools of muddy water. These are some of the biggest problems that come with the monsoon season. And as these puddles act as breeding grounds for mosquitoes, health concerns between June and September see a significant rise.
I got dengue in August 2015 and was admitted in the same hospital. It was 26th of August 2015 when my platelet count was down to about 8,000, and doctors were planning to do something extra. They were willing for getting platelets for myself, and it was not easily available in blood banks or hospital, and I was getting hopeless.
Ailing with dengue, Jitendra had to deal with the added stress of finding suitable donors at short notice. This is an experience that Friends to Support is hoping to change. Currently hosting a network of over 2 lakh people across India, it facilitates direct blood donations when blood banks or hospitals fall short.
मेरे रिलेटिव यहाँ जयपुर गोल्डन हॉस्पिटल में ही एडमिट हुए थे। इनके प्लेटलेट्स काफ़ी डाउन हो गए थे, 8,000 से 10,000 के बीच में रह गए थे। ब्लड ग्रुप इनका बी नेगेटिव है। हमें कोई डोनर मिल नहीं रहा था क्योंकि उस समय पेशेंट बहुत ज़्यादा थे, तो हर कोई कह रहा था मैं डोनेट कर चुका हूँ या मेरा ये ब्लड ग्रुप नहीं है, तो हम काफ़ी घबरा गए थे कि भाई क्या होगा।
Last year alone, nearly 1 lakh cases of dengue were recorded in India, most of them between July and September.
Particularly in June and July, where the monsoon season occurs in India, there is a huge demand for the blood because of the dengue cases. You know that in dengue, we need a fresh blood platelets.
As dengue cases rise, the demand for blood rises too. This year, nearly 119 cases of dengue have already been reported in Delhi alone, with 91 of them seen in July itself.
We have so many cases where the platelets count down to the 10,000, 8,000, which is so much critical, and a patient can die in those situations, and they don't find the relevant blood donor in their area or in their neighborhood, so that a person can come and donate the platelets. So in such critical situations, this website really works.
Friends to Support was built out of personal loss due to lack of blood in 2005 by 5 college friends. What started out as a register with a list of names is now a widespread digital network of voluntary blood donors. The founders wanted to ensure that nobody is left panicking when a friend or relative needs blood.
There were few incidents which occurs during that point of time when I was in college, like one of my friend's father died and one of my relative died because they don't get the blood at the right time. So the main idea cultivated at that point of time, and I have decided to do something in this area. So I formalized a group, a close set of friends who also follows the same concern.
According to the National AIDS Control Organization, India faces an annual shortage of 11 lakh units of blood, which is almost 10% of the total requirement based on the country's population.
There is a huge difference between the demand and the supply of the donation in India, particularly India, and that is up to 50%. And so many people died because of they didn't get the blood at the right time, at the right place. And at the same time, we found that there are so many people are doing illegal businesses in this area. They are selling blood at the higher price. They are, they are exploiting poor people and uneducated people. They get the blood from them and sell at the high price.
In 1996, the Supreme Court banned professional blood donors across the country so that nobody could buy or sell blood like a market commodity. Still, such illegal activities continue to exist.
Last few years, we have seen this dengue outbreak. Platelet count goes down, and to meet with that shortage, we have to collect more blood. Still, we need more and more of such blood banks where the blood is available to patients easily without giving any replacement donation, At present in hospitals, we ask for replacement donor first, and then we are able to provide blood to patients.
As per a statement released by the Ministry of Health and Family Welfare in Feb earlier this year, India currently has 2,708 blood banks. While these are spread across cities and towns, there are 81 districts in the country that have no bank at all.
Right now in India, the smartphone users are increasing day by day. So we have recently, prepared the mobile apps for this website, and this is freely available from all the 4 platforms like Android, iPhone. So people like you, if you are going and you have the mobile, you can download our website app free of cost, and find the blood donor right away.
The company claims to have saved over 4 lakh lives through directed blood donations on their platform. While the Limca Book of Records 2016 has named them India's largest voluntary blood donors website, they still believe that this country has a long way to go.
In developed nations, there is number of volunteer donors are very less. Like if we compare, I have some data. Like in Switzerland, there are 113 people, over 1,000 people who donate voluntarily. In Japan, it's 70. But India, just guess, it's only 9. 9 out of 1,000 people who donates regularly.
As several blood camps observe, people often shy away from donating blood due to myths about infections, weakness, and other misconceptions.
Anybody who is coming forward for the first time is very apprehensive about the needles, the hygiene part of the blood bank, whether they are licensed or not, and whether the doctors are qualified or not. So all these aspects are in the mind of a donor.
Since digital donation platforms facilitate direct transfers from the donor straight to the patient, it gives donors the comfort of knowing where and how their blood is being used.
मैंने रजिस्टर किया, फिर मुझे एक डोनर मिले, तो मैंने उनसे कांटेक्ट किया, विनीत जी, जिनसे मेरी बात हुई, वो रेडी हो गए ब्लड डोनेट करने के लिए, तो आए, जल्दी से जल्दी आए, तो उन्होंने ब्लड डोनेट किया, और हमारे जो पेशेंट है वो रिकवर करना शुरू हो गए 1-2 दिन के अंदर.
Patient was suffering from dengue and the platelet count was really low, and luckily the blood group matched, it was B negative. So I readily agreed to donate my blood, and I went to the hospital, Jaipur Gordon Hospital, and I donated blood, and luckily the condition of the patient started recovering after 1 or 2 days.
I got a call and came to know that the person wants blood. So over here directly I just went there and I donated my blood. I can see where my blood is going in good hands. So was very satisfied with this app rather than going and or if you're donating a blood, it is just going in any hospital or in any bank and you don't know where it is going. It is going or not also, or it is being sold by money, like people are paying for it.
Apart from India, the company is present in other countries facing blood shortage problems such as Yemen, Nepal, Bangladesh and Sri Lanka.
So shortage is there, especially in remote areas and small places where they don't have facility, good facility. So we should look forward for more voluntary donors and meet with the demand.
Along with Friends to Support, other startups such as Blood Connect are also working towards bridging the demand and supply gap. The Rotary Blood Bank is also currently developing a similar application named Blood Port.
When a user needs or a patient needs, he can be able to get on his palm, on his app, where the blood is available, how many units he can take, whether the group is available or not, and if he wants to donate somewhere, he can see where the camps are happening. So technology is going to make a big difference, you know. It will be a big support to the voluntary blood donation program.
As health concerns rise in the monsoon, blood shortage is only one of the problems. With an increase in travel time and traffic, patients are faced with the additional difficulty of having to go out to buy medication or get a blood test done. OneMG is an online platform that offers e-pharmacy and e-diagnostic services across 30 cities in India and saves users the trouble of having to travel through congested or waterlogged roads. It also ensures that the drugs are safe and not spurious or tampered with.
One of my family members was not well, and outside my home it's a lot of water, so I'm not able to drive also outside, and I was a little stuck into the water. So I was just browsing for medicines and all, pharmacy, where I found OneMG app.
they claim to have 80 million annual consumer visits and 6 million app downloads. Since the company lawfully insists on prescriptions to fulfill medication requests, they are unable to supply 40% of the demands made in an attempt to weed out self-medication.
It's a pretty simple process. First of all, a consumer has a prescription, they just click a picture of that prescription, let us know that they need medicine for 10 days, 12 days, and that comes to our call center, from where we forward it to a pharmacy partner.
Once the prescription is verified, 1mg identifies the pharmacy closest to the user's location and delivers the medication straight to their doorstep.
Within 12 hours, I have received the medicine, and it was very helpful for me that I can save one of my loved ones.
Along with on-demand meds, 1mg's unique proposition is an extensive digital encyclopedia with credible information from doctors about medicines, drug formulas and health content, so that users are better informed.
See, healthcare is one of those spaces where it's full of opacity. So transparency is something that is missing from this space. A consumer typically finds himself or herself at the periphery, just being told what to do. Now, what we have done is taken some complex medical information and made it into a very easy to understand format for the consumer.
Whether it's a headache, a tooth infection or chest pains, people often Google their symptoms and find results or advice on multiple platforms without verifying the credibility of that information.
Consumer is like trained to believe that it's so complicated that I'm not supposed to even try to know what I'm taking, when it's one of the most important things. It's a chemical product you are taking on somebody's suggestion or direction. You need to at least be aware of what it can do to your body.
India still has no concrete law that requires generic formula medicines to be prescribed, only guidelines. As Prashant points out, medical reps from big pharma companies can often sway doctors towards one particular brand or drug.
It should be, doctors should be mandated to write generic medicines, and even if they write specific brands, the pharmacies should have a right to provide the consumer with the cheaper substitute if the consumer so desires. If you make the consumer aware of their options, their rights, then consumers will demand better healthcare.
1mg search data shows a 32% rise in online searches on their platform for anti-infective medication in July as compared to the March to May period.
There's a very clear spike in infectious diseases and related searches on the platform. I took out the data. In July, we were 32% higher than March to May. It's reflective of what is happening. In fact, the doctor consultations around fevers, virals have also gone up.
Since lack of awareness about the monsoon and related health concerns can cause serious problems, 1mg attempts to educate users specifically about healthcare this season.
We do send out articles on precautions people should take. We send out information of if you have fever, what are the things to do, not do. For example, certain medicines you should not take if there's any chance of you having dengue.
1mg has a widespread network across India's metro cities.
So it includes Delhi and all the NCR towns. It includes most of the metros. In Tier 2, we are operational in some cities, like we are in Ghaziabad, Lucknow, Indore. So a few Tier 2, select Tier 2 cities and most of the Tier 1 cities.
Apart from 1mg, other companies such as Curofy and MedIndia are also working towards making medical information accessible for consumers. However, there is still a need for more digital health content to be available in regional languages. With costly consultancies and tests in India, several people end up self-medicating to avoid going to a doctor. Now the question is, can new technological portals with health information make people more responsible with their healthcare? It's time for a short break now, and we'll be back with how technology can change the way we do doctors' visits. Stay tuned.